Hi, everyone. A very good evening to all the Women Who Win members who are on our page, on the group, and also on our YouTube channel. Today, we are covering a very sensitive topic, that is mental health. We are talking of mental health today on our live chat. And if I say mental health is the current silent pandemic which we are facing, which people are not talking about. Now, today being the 10th of October, which is taken as a World Mental Health Day, and why we are dedicating this day, we are going to hear some insight today from the experts. Today we have Dr. Preeti Chawla, who's a counseling psychologist, and she's going to show us and take us through how this mental health is becoming the current silent pandemic. I want to talk about the current scenario I just digged out. That is, in India, 90 million Indians, that is around 7.5 percentage of the country's population, of which is 1.3 billion, suffer from mental disorders. And some of them are not even highlighted and talked about. This is the WHO report which is given in March, and after March, pandemic and lockdown must have created much more cases. So I'm going to invite Dr. Preeti Chawla now, and we are going to ask few questions, and I'm sure you guys are there to hear her, and you can ask questions to her. Hi, Dr. Preeti Chawla.
Hi, Simi. Good evening.
A very good evening to you, and welcome to Women Who Win, and giving your time to the women of our community, and they can ask questions and sharing your knowledge on this particular day, that is Mental Health Day, which we talk 10th of October. So, introduce Dr. Preeti Chawla is a counseling psychologist. She's a homeopath blogger and a yoga instructor. She has a holistic approach towards mental health care. She's been in healthcare for 15 years and working with human mind since 8 years. That is a small introduction of our doctor here, who's come to share some knowledge and answer your questions. Dr. Chawla, I want to ask why the need of celebrating this or dedicating this, not celebrating, dedicating this day to mental health?
Simi, there are two views that I have about this. One is something that's very positive, that mental health is being given importance as much as physical health, with a day being dedicated to it. But on the other hand, it at the same time makes me realize that we need to reinstate again and again to ourselves that there is something called as mental health that we need to take care of. And that is why a day being dedicated or a day being allotted to it as a reminder to us.
Yes. So this is the need. I feel so much. We are hearing of mental disorders, and we are seeing in all age groups. It's not particularly to some age group. It's now coming to even kids, small kids, teenagers, mid-age, and then even the older people who suffer loneliness and being alone. So it's becoming we are talking of corona as a pandemic, but I feel this is a very silent pandemic which we are not realizing because there's a stigma attached to it. What do you say?
Right. There is definitely a stigma attached to it as far as I think of the Asian countries concerned. If we look at other continents, if we look at America and Europe as a continent, as two continents, the Swiss countries, they are very pretty open about uh, seeking out help.
Yeah.
While approaching a therapist or a counselor is too stigmatic. I agree that we are growing. I agree that there is awareness being generated. People are getting aware of this because they're reading stuff, they're watching stuff. But there is still a lot that we need to cover up in terms of awareness towards mental health and towards seeking out help. What happens
Yeah,
is, I believe that we come from a very strong family system, and when we are growing up, things or whatever is happening is in the family is to be kept within the family. So we are taught that way कि घर की बात घर में ही रहनी चाहिए.
yeah,
बट जैसे शरीर की बात आप अपने डॉक्टर को बताते हैं, उसी तरह से मन की बात आप अपने साइकोलॉजिस्ट को या साइकाइट्रिस्ट को बताते हैं. दैट इज ओके. You know, we have to come to that point where we know that it is okay when you are not okay and you need help and you reach out for help.
yes. So
And
that's, I feel, the first thing one has to learn about, that you need to be okay and talk about it. But there's a huge amount of, I feel it's not an easy journey because as we are talking of stigma attached to it, how to change the mindset and how to, um, you know, how to overcome that.
so when we talk of the stigma, we are talking of people around us. We are afraid of that labeling, you know. You're going to a shrink or you're going to a psychologist means something is wrong with you or you have lost your mind. But we need to understand that therapy or counseling or visiting a psychiatrist doesn't mean that one is gone insane or one has lost their mind. So there are three reasons or there are three ways that you approach a therapist for, as in three reasons in life. One is, of course, when you're facing an emotional hurdle or a relationship issue, or you yourself are going through an inner conflict.
Yeah,
One is that. So we approach to get clarity and to help us navigate that way. Second, we go when we are facing something like depression or anxiety, कुछ strong symptoms आ रहे हैं या behavioral issues हैं.
yeah,
One. Thirdly, if we have something from the past, some hurt, some pain, or some anger, which is challenging our present life also. So we need to heal and we go to a psychologist or a counselor or a psychiatrist. Fourthly, if we only need to understand ourselves, one may not be facing any challenge, one may be having a very smooth life in the present, but you can undergo therapy to gain more clarity about yourself, to understand yourself as a person, and how do you want to grow in life. Even when it comes to just growth of an individual without anything to heal, it needs therapy. I mean, that also is a section of therapy. That's also where a counselor comes in. So that doesn't mean you have to wait for something to be wrong with yourself to reach out. So one has to understand that to overcome the stigma.
okay.
Secondly, yeah,
Yeah. So you've given 4 points. That is, if you're facing anxiety, there is some behavior changes you see. Then you see there's some anger. There's you see that you're getting unnecessary. On small things you're getting angry about. So you need to understand all these symptoms. This is what you're talking about.
right. So you need to
Okay.
be aware that you're facing this. So one has to
Yeah.
be into that awareness कि अंदर चल क्या रहा है, हो क्या रहा है.
Mm-hmm. Okay, okay. Okay,
Then
so once you are aware, okay, if you feel there is a need, what should be the next step taken?
next step is to reach out for help without uh, getting into that impression of लोग क्या कहेंगे. You know, our society, we have this saying ना, सबसे बड़ा रोग क्या कहेंगे लोग.
हाँ,
So if
बिल्कुल.
you need help, it is you need help. People are not going to help you. If you don't seek help, you only get complex and complicated अंदर ही अंदर within yourself. And nobody is going to be able to help that. जिन लोगों का हमें डर है कि लोग क्या कहेंगे, be it family, be it relatives, be it friends or society.
Hmm.
So one has to curb that need for validation from people because health is one's priority. And especially, I think that most of the diseases are psychosomatic. That is, it starts from the mind. The cause lies in the mind. So any kind of
Yeah,
stress can build up a physical disease also. So खुद ही face करना है. It's not other people who are going to face that. So we need to understand and be firm about it. One is being firm about it. Secondly, you go
yeah,
out and seek help. Thirdly, if you think that there are questions arising from your immediate family or your spouse, sit with them and tell them this is your problem and this is how it is impacting your life. Let them also understand what is it that you are emotionally or at the level of feeling going through. आप इमोशनल लेवल और फीलिंग के लेवल पे क्या महसूस कर रहे हैं और वो आपकी लाइफ में किस तरह से इम्पैक्ट कर रहा है. हाउ इज इट होल्डिंग बैक इन लाइफ, हाउ इज इट पुलिंग यू बैक इन लाइफ.
Yeah.
Thirdly is that talking to the family becomes essential so that they are in awareness and can lend you the required support.
So family is very important here. Your near people who are around you, family, friends, these they need to understand. And so family plays a very important role when you see the symptoms. That's what you're saying?
Family does play an important role, but absence of family support does not mean that you cannot reach out for help or therapy will not impact you or will not have its effect without family support. It doesn't. I mean, it
Okay.
will have its entire impact. Family will act as an adjuvant, as auxiliary support, as something that's
Okay.
extra.
Okay. Okay. So, for example, if we've identified that we have an issue, now who should you approach first? A psychologist? That's what the first step one has to take.
Yes, it is the psychologist first because most of the conditions can be handled just by counseling and therapy. And
Okay.
let medicines be the second resort and not the first resort. Yes, having said this, where there is a question of suicidal tendencies, do reach out to a psychiatrist at the first go. In the
Okay.
meantime, you can go looking for a psychologist and then combine both together.
So it
Then,
should not. It should not be to a psychiatrist first. It should be to a psychologist first because people don't even know. Once they are aware, they don't know who to go to. Then there are clinical psychologists, and so can you
okay,
help us with that? Yeah.
sure, sure. A clinical psychologist does the testing and diagnosis part of it. Okay.
Okay.
Diagnosis may or may not be required for therapy or for counseling.
Yeah.
Clinical psychologists at the same time are also capable of doing counseling, but it is to their choice. So if they specialize with diagnostic and testing, stick to that. If they also offer counseling, one can go to a clinical psychologist as well for counseling.
Okay.
A
Okay.
counseling
Okay.
psychologist only offers counseling and therapy. They do not do diagnostic testing. For example, I do not stick to diagnosis most of the times unless and until I see some very strong behavioral changes and which makes me or which brings me to a diagnosis in terms of observation. Then I might send a client to confirm my diagnosis. Not otherwise. I do not uh, counsel with the diagnosis. I stick to whatever changes in the behavior that the client puts forward.
Okay, so once a person connects with you, you see the changes, you see the symptoms, and that's how you start the
Yeah.
process.
What they
Okay.
talk about, they
Okay,
want
so
to see.
the next question, what I want to, you highlighted the, the symptoms. So how should people take care of this? Can they do something on their own? Today's topic is how to take care. So let's highlight on those.
Sure. So first, one has to be in awareness of what are the abnormalities that one should be alert about. So any behavioral changes, any changes in your daily sleep, daily behavior, your daily things of interest. So losing interest in things that you like is something you need to be alert. It's a symptom. It's a red flag. Okay. So observe
Okay,
yourself, watch yourself. Changes in
okay.
sleep, changes in your appetite pattern. You're overeating or you're undereating than the usual. Any kind
Okay.
of mood swings. So if you're swinging between anger and too much of compassion on the other extreme, so you're swinging between extremes, you know that you need help. It could be just simple stress. It may not be a disorder. It may just be stress, but that stress needs
Hmm.
to be relieved. It needs to be managed. So
Okay.
when you're losing interest in things that you would do daily, something even like bathing feels like a task to you. getting up in the morning and not wanting to get out of bed, not looking forward to good things in life. So these are the things which amplify that you need help.
So you just said that they can be stress. So what is the fine line between stress and a little more than stress? Yeah,
Okay. So the fine line between stress and a little more than stress would be same as between sadness and depression. So you're just feeling sad, उदास feel कर रहे हैं, थोड़ा सा रो
mm,
दिया, मन हल्का हो गया and you're fine. So that is
yeah,
okay. Okay.
yeah,
Lekin if it's repeating again and again and it's getting intense, the
mm,
thoughts do not stop. The thoughts drag you down. They pull you down like a whirlpool. That gets into somewhere around feeling depressed or depression.
mm,
Similarly, the stress you're able to manage, you're able to cope up very well without any changes in your behavior. Some
yeah,
behaviors will irritate stress, so it's time that you look out for de-stressing activities or techniques. So something like meditating, doing yoga, taking a break, doing your journaling, going out for walks, exercising, making sure you're sleeping fine. अगर ये चीज़ें इन स्ट्रेस को मैनेज कर पा रही हैं, वेल एंड गुड. अगर इसके बियॉन्ड भी बिहेवियरल चेंजेस लग रहे हैं और यू फीलिंग दैट डिस्टर्बनेस विद इन, देन यू नीड टू रीच आउट.
okay, okay. So, yes, I'm sure you must have handled a lot of cases. Which is the current, you feel from your point of view is the, area or age which you feel is getting or facing this mental
Yeah.
illness or disorders? Yeah. I know it's
Before
for
that,
all ages we are talking of, but currently
yeah,
what you feel is,
yeah. Before that, I would just want to point out a few tips how you take care of yourself.
yeah,
So something very basic like a very healthy diet. I'm not saying minus complete junk.
yeah. Sorry. Yes.
That's it. Just
I got
just
a call which I have to switch it off. Yeah, yeah,
okay. So
yeah,
making sure eating healthy. When I say healthy, I mean unadulterated food and definitely some element of raw fruits or vegetables. So something like salads and fruits, which is raw and fibrous, is very important for the mind. So in Hindi
okay.
we have this. In Hindi we have been having this kahavat since ages. जैसा अन्न वैसा मन. But that literally
Yeah,
holds.
true.
Yeah.
बहुत बार सुना है हाँ सात्विक and yeah. Hmm.
So the kind of food you're having will uh, okay, so the kind of food you're having is definitely going to influence what you feel. It's going to influence,
Yeah,
it may not be the root, but it's going to influence. So have
yeah,
healthy, fresh, unadulterated food. Prefer as much as homemade. Now, the pandemic scene being there, I strongly recommend homemade food and not, ordering from outside or having outside snacks.
yeah.
Like after food, it is physical activity. So make sure you're moving your body in some or the other
Okay.
form. It could be a dance form, it could be a sport, it could be gymming, yoga, anything, cycling. So we are in an era wherein we have so many options to move our body. And if we are not doing that, then we need to go back to the previous centuries when we are not able to take advantage of the present.
Yeah.
Third, very important is making sure you sleep enough. The quality of sleep is very important, not the quantity. So sound sleep even for 6 hours may help you a lot. Unsound disturbed sleep even for 8 to 9 hours may not help.
Okay. Okay, so so what you're saying is all these things, the regular activity basically, it's nothing unusual. It's the regular things. If you feel there is some disorder, something you're not. So people who kind of have restless sleep, what do you say? There are a lot of people who sleep, who move a lot and restless when they are sleeping at night. What do you say? Is this something a symptom?
It could be just anxiety at some level, a stress that they have not been able to tackle, or some kind of
Okay.
anxiety, short standing, a recent anxiety, or something that's long standing.
Okay, okay, yeah,
So that anxiety needs to be checked.
Okay, all right.
I,
So,
I,
yeah, yes.
this is a 50-year-old girl who's dealing with sleep issues for the last 1.5 years. She has recently come to me. I have just done 3 sessions with her, and she said that she hasn't slept for the last 1.5 years. She sleeps 1 or 2 hours, and when we rolled it back, it it has its roots with anxiety related to the loss of a parent.
Oh my God. So,
We
how do
have
you
the,
come to this analysis?
that's when we
Yeah,
take the
it's
history.
amazing, amazing. So, how you're saying it's been, the baggage which she's carrying? How do you? So, there's a lot of sessions you need to take and come to. For example, okay, we take an example of maybe someone who's having sleepless nights for 6 months. So, how many sessions one needs? Just a kind of a, yeah.
No, that's something that's completely unpredictable because the root or the cause may be traceable in the first 2 sessions, as with this girl we were able to. It whatever is overwhelming to the client in the present is the reason of the present anxiety. Once that settles down, then we go back a little in time. We go back a little into the history of what other anxieties have been chronically with them. So
Okay.
it may take something like 6 to 8 sessions, or it may take even beyond that. It is completely up to the need of the client in terms of the emotional upheaval that's going on.
So, would they need a medication in this kind of a scenario?
No, I stay away from medications as much as possible. Only when I see emergencies do I recommend medications, not otherwise. If needed, I add on homeopathy with their permission, of course, with their consent. A psychiatrist is in extreme cases where I need a support when, say, it's an extreme case of depression or anxiety, not otherwise. Therapy can handle most of the things. Even if it's
Okay.
complex, even if it's complex, it may take time, but it will handle.
All right. So, a simple anxiety, it's a very term people are using these days. I'm very anxious, and then there are some people who are restless, who keep moving. Are these also one has to look, someone you sit, even in the office scenario, is someone who's moving the leg very often or, tapping the table very often. I'm just kind of, since we are talking, I just remember that you're saying anxious. Is this a symptom?
That's a part of their personality. So that's called
Okay,
as the restless leg syndrome, which is actually a part of the personality. So the person basically is one who is very anxious.
okay,
Not necessarily that there's a reason which needs to be tackled. The basic personality is of an anxious type. So anything,
okay,
even something that's minor for us may be something that's major for them, because they basically have an anxious personality. So उस पे कुछ अगर add on होता है, कुछ incident या crisis, वो उनके लिए और भारी पड़ता है. So it's better to move from an anxious personality to a slightly grounded plus anxious personality. Maybe not completely change to zero, but add an element of being grounded.
So I'm just thinking that if someone is like, if you're not damaging or harming, it's not bothering you, it's a personality. That's what it is. But if
Yes.
it's working, taking some action which is not right, that's when you
Yes.
need to take care of it. So, how would you treat such a person?
So that's where in therapy comes in. We start with
Uh,
taking the history, and now someone with anxiety will need a different therapy or a different course of therapy than someone coming with trauma.
oh,
So if
okay.
trauma needs to be healed, anxiety needs to be just molded into something that's more constructive. The energy needs to be channelized.
Okay.
So
So
therapy
there's
will,
lot of
yes,
understanding you need to do, and the person should have that total trust in the doctor or the person they are talking to. That's the key requirement. And I see a
yes.
lot of comfort. You actually give so much comfort. to a person. This is just, I thought I must tell you that you want to open up and talk, that yes, you are listening. Yes. So this is, I feel, from a doctor's point of view, has to be the patient has to be whoever comes to you. Yeah,
Yes, that's very important. The comfort, the trust, that space of non-judgment. Because we
yeah,
have, and see, when we go out in the world, everyone is busy judging us. I mean, that's the
yeah.
human tendency. When you come into therapy, it's a safe space. You don't feel judged. You're not being analyzed. We we don't look into what they are acting. We just look into why is it happening. So my job would be to, if you are exhibiting a certain behavior, I will look into why is that behavior coming up. That's my work. So I will not judge that it's good or it's bad. I will only look into why it's happening.
So I'm sure people must be feeling, whoever is seeing, I can see a lot of women out there watching and silently watching. Otherwise, there's a thumbs up. So again, as we say, that there is a stigma attached to it. If someone is not, I want to tell those people who are still uncomfortable in asking a question on an open forum can connect with Dr. Preeti Chawla. We'll share the contact details and you can connect with her personally. We understand that. But yes, to the next question, I want to ask Dr. Preeti, some stories there. We have a lot of women in the group. So women is like women who are into the age group of 28 plus to 60. That's the age group of our community. And what do you have to say to this? There'll be a lot of women who will be seeing this.
So we women as a gender, again I'm talking from a cultural point of view also, have always learned to sideline ourselves. Even if we look into modernization and progressiveness, it is somewhere that our self-esteem is still not that strong enough that we do not ignore ourselves. We end up ignoring ourselves at least to a little.
Yeah.
So my first and very strong, with a lot of love, I say that make sure you have a good connection with yourself.
Mm.
Make sure you're connected enough to yourself. You are committed to your care as much as you are committed to care of others.
Yes. That's why
If
they say first take care of yourself and then you can take good care of others too. Yeah.
exactly. This reminds me of when we travel by aircraft. The air
Yeah.
hostess is also instructing us पहले अपना ऑक्सीजन मास्क लगाना बाद में किसी और की हेल्प करना.
Yeah.
So it's the same with us also. Look after yourself. Make sure you're taking care of your physical health. Secondly, be in touch with what you're feeling. Understand what you're feeling. If today I say I am not feeling good, but what is this not good? Is it sadness? Is it anger? Is it disappointment? Try labeling your feeling.
So what if you're again? I would ask a question because I want to. What if okay, this is what? Then what next?
Then you sit with that feeling. When I say sit, means acknowledge its presence. What happens is mostly मुझे गुस्सा आ रहा है या मुझे किसी ने कुछ कह दिया. I get, for example, I might distract myself by getting busy into work or having a
Mm,
lot of food, gorging on some food, hogging on some food, or taking in alcohol. These are
mm.
things that suppress those feelings. And when these are suppressed,
Yes.
it gets
Yeah.
complicated inside.
Yeah.
It gets very complicated. So when you have labeled what you're feeling, you acknowledge its presence. You allow yourself after that to feel that feeling. अगर उदासी फील हो रही है तो उस उदासी को पूरी तरह से फील कर लो and then come out of it. Don't stay there. At the same time, don't run away from it. Allow yourself to feel it completely. Unless and until an emotion is not completely felt, it will not finish its course.
Yeah.
After you have felt
Some,
that feeling,
sometimes we don't know where, you know, I'm sure we all go through it. We don't know. We distract ourselves. You said rightly. You binge, you eat chocolates, people get onto alcohol, you watch TV. Sometimes you're just watching blank. When you're going through the emotions, you're thinking something else, and you're so. So basically, it's your own journey. You need to come over, get over the whole situation, and the how the external help will, again, I would again ask how, when should one get in touch with people like you, or counselors like you? Yeah.
So if it is something that you are not able to tide over, now that you have sat with feeling sad, आपने वो feel कर लिया, लेकिन अगर ये
uh,
चीज बार बार आपके साथ repeat हो रही है, at times sadness has no reasons. One of the reasons is that when sadness is from an unknown source, so it is coming from within, it's not coming from external sources, you need to reach out.
yeah. Okay.
When you, there are certain hurts and pains that one is able to get over, one is able to overcome. But then there are certain hurts and pains which are complex enough that you are not able to get over them, or you're not able to heal yourself out of them. It keeps coming back to your mind and it gives you the same pain. Now, when do we realize whether we have healed or not? If we go back, कोई इंसिडेंट घटा, उसके बाद आपने अपना ख्याल रखा, you help yourself heal. And if you go back to the same incident in your mind, and you can do that without pain, know that you have healed. But if it
Yeah.
is giving you pain, it is giving you trouble, it's making you restless, it's making you angry, that means it needs to be healed. Approach a therapist.
Yeah, that's so right. I can feel that. Yes, then there are certain incidents you, uh, initially you feel a lot of pain and you feel, oh, something is happening, and you're just getting crushed, and then slowly as the days go by, and then you kind of think it and you just forget about it. So then you're healed, this means. But you are thinking again and again and again, you're living over that thought. That's when people should get in touch with you. Okay,
Yeah, we
great.
need to forget this idea of that time heals everything. Time does not heal most of the things. There are very few things which we leave to time to heal.
Yeah,
But most of the things need to be entered into, got into, and to be healed. You have to work actively on that.
yeah. Okay, so Dr. Preeti, the next question which I want to put is, in the last 1 week, I've kind of heard about a lot of teenagers getting into severe depression and mental disorders due to maybe a simple reason like a teacher said something in class, okay, or someone is judging my looks. A very small thing can, so you really wonder as a lay person that what actually happened, and the person, the kid just locked herself or himself in a room for few days, and then the kid came out and told. So how this all happens, what actually happens when they hear or go through this?
Okay. So with the teenagers, there are a lot of challenges with self-esteem and peer pressure. So there is a certain thing that they need to match up with in their peers. With this whole thing of social media, the
Yeah,
likes, the
yeah,
comments,
yes,
the need for external validation has just risen like anything. I'm not against social media at all. I love it, in fact, because it's a
yeah,
good platform to reach out to people, to send out messages. But for teenagers, it gets complicated. They need to reach that match of their peer.
yes.
One is that वहाँ पे सेल्फ एस्टीम बहुत drastically impact होती है. You need a certain kind of phone today. You need to have this phone. You need to have such outfits only. You have to go to such places. You need to have these apps and stay engaged into them. भले ही बच्चे की क्रिएटिविटी पर कॉम्प्रोमाइज हो रहा हो, लेकिन peer pressure के वजह से you have to be on that certain app and give out
Yeah,
genuine videos today. There's a lot of
yeah,
pressure that, so
yeah.
there the child's decision making capacity comes into question. So if the child has been brought up wherein he or she has been very well grounded and rooted, and they're very sure of themselves, these issues in teenage can be less. Like you
So the
said,
parenting role becomes very important here.
very important, especially the communication part of it. So
Okay.
as long as the child is made to feel loved, as long as the child is feeling loved by the parents without any judgment, even if your child is not an obedient child, never make the child feel judged. You can
Yeah.
always convey to them that this is a behavior which I don't like, but never convey to them that you are the person I don't like. So we are not judging the person. We are just telling them
Hmm.
about the behavior.
Okay, okay. So I feel here you need to give some tips to the parents.
Communication, like I said, very important.
Yeah, first is communication you're talking. Yes.
Yeah, so the communication has to be open. Be very good at listening. Parents have to be very good at listening rather than talking.
Hmm.
Till a certain age of 12 or 13, you have taught the child what should be, what is right and what is wrong. You have given values to the child. After 13, 14, you need to sit back and observe what the child is doing with those learnings and with those values. Yes, when it comes to, when you see that the child can be hurt, take drastic steps to make sure that the child is not hurt, but allow them to make their decisions and learn for themselves.
Yeah,
Do not be an overprotective parent. No, teach the child to be very sure of themselves, to get that confidence on their own choices. Let them build their criteria of success. Don't enforce your dreams on the child.
yeah. This is what nowadays I feel that's the biggest pressure on every child. We all are pushing our
So,
dreams onto. I want you to be like this, best in sports, best in
the
extracurricular. Yeah, yeah. There's a lot
coding
of pressure.
courses, their advertisements on social media. Oh God, it really makes me sick in the stomach when I look at people wanting to enroll students for coding at age like 8 or 9. I mean, what
Hmm.
is बच्चे का बचपन कहाँ गया? The child
Yeah,
has childhood which is well spent. No matter whatever modernization we may undergo, but a childhood for the child is required.
yeah. True, true.
Be a good listener, less of a talker, so that
Yeah,
you can be and the child can come and confide into you whatever they feel is not right with their life. If we are
yeah.
more of a talker, the child feels judged. And when the child feels judged, they stop confiding.
So what is you say that social media is we all know. I also use social media, but we are mature enough to understand how much we want to use and how deep we want to get into. But kids they don't. So some of the parents are totally very free with the social media. They just say, oh, that's there. Or some are totally blocking the kids nowadays. I've heard a lot of because everything is going online, so they are restricting the time and
Access.
the access. So that is right. You feel that's the right way?
Yes, restricting is fine as long as we're not bringing it to a zero. So if it was 10, bring it to a 7 or 8. Don't bring it to 4 or 5. The child will not be able to cope up.
Yeah,
Very
exactly.
stressful
Yes.
result.
You
So whatever
cannot, yeah, let them, we need to let them grow with the current scenario. That's what I feel. Yeah,
exactly you need to
yeah,
let them grow at the same time safeguard, but don't be overprotective.
yeah, yeah. So parenting is very important. So I feel whether parents or kids, so you have a solution for all. Great. Great tips. Yeah. The mother should get in touch with you if they are facing a problem. Kids can get in touch with you. Anything else? Add some nice experience or a story you want to share in just in the end?
So with this current now we have a lot of access to reading stuff, especially when it comes to psychology related, relationship related. I'm happy with, it's kind of a global movement wherein people want to work on themselves and their relationships, unlike the
Yeah.
previous decades. So
Yeah.
make staying in that awareness is very good. Just three tips that I would want to give away towards the end. One is take out time for yourself
Yeah.
so that you are able to stay grounded. Staying grounded will help you in making better decisions in life, be it personal or professional. Communication in relationship is the key,
Yeah.
and allowing yourself to be in the awareness of what you feel is very very important. When you are in that awareness of what you feel, you also lend a comfort to the other person in your relationship. wherein they are also indirectly permitted to know what they feel.
Yeah. So
When you are a
giving
person,
understanding yourself and understanding others is also very important
yes.
because, yeah,
So when we are able to understand ourselves, we'll be able to understand others and give them the benefit of doubt also when required.
yeah,
And we don't
yes,
grounding, not having impulsive decisions to make, goes along with not
yeah.
making impulsive decisions.
One thing I want to add, which in the current situation has led to a lot of relationship issues, also kids issues. That I'm sure it must have increased a lot. You must be knowing. What do you see? Relationship issues getting, this with
Yeah,
everyone being at home, working from home.
with the current pandemic, everyone sharing that with his skills. We are not used to having others around for 24 hours. It would be
Exactly,
8
exactly.
we would be at work. We would have our own space. So
Yes,
relationship issues in all kinds of relationship, not just spouses, even between the teenagers and their parents. I have when I was doing a session with the college recently, they were asking me, "Ma'am, parents privacy नहीं देते, अब क्या करें?" They
yeah,
have so if every relationship is undergoing a challenge, but this is also a time when you understand the other person better. You understand their vulnerabilities better. You understand their
yeah,
needs better. You have the
yeah,
patience.
yeah. True. So that is really we need to be very because this scenario is going to continue for some time, and we need to give space to each other, which is so important. You can see the people who are into nuclear families would be with kids, but their joint families, they you need to multitask and do your household work and work also, so that is stressing a lot of people. I know some cases where they are totally changed personalities because they've not been able to handle stress. This,
Yeah.
as you're
So
saying, there's no me time.
there is no me time, and there's a lot of work. Again, we are doing jobs which we are not used to doing.
Yeah,
With no domestic help, with a lot of work, cooking, cleaning, managing kids, managing the spouse, managing everything. So
yeah,
here, what how people can help themselves is again communication. Partners
yeah,
should be communication. So sit down and tell them this is what I am facing. This is my challenge. I need help. How can we work this out together?
yeah,
This could be with your kids. This could be with your spouse. This could be from a child to a parent.
yeah, yeah. So great. It's such a delight talking to you, Dr. Preeti. I just want to hear more and more because there's so many. We all face these situations. As I said, keyboard कहाँ line draw करनी है, understand करना है. It's for us to understand and be aware. Take a me time. That's what you've said. How to take care. I feel these are the main. Understand, be open about it. Don't think it's a stigma. A lot of people are talking about it's like every you talk about mental health is really really now coming and people are taking action. Then to take me time and don't judge. That's what you're saying. When there's an issue, don't judge. Yes. Have I missed anything?
Something as basic as food, movement, and sleep
Oh
can go a
yes,
lot.
yeah, yeah. Food, yes, food is very important. So that is home food, healthy food. So you said fruits and salads are very good. Alcohol is no, no. Alcohol and chocolates.
In in moderation, everything is fine. Even junk
Okay,
is
okay.
fine, but make sure you're
Yeah.
moving your body so that the toxins can be thrown out.
And yeah, exercise, stay healthy. Yeah,
Yes.
because our body movement is also in this lockdown time, we are not physically moving so much, so we need to exercise, have a discipline, have a regime. And if you are not able to handle and you're still facing a problem, we're going to share Dr. Preeti Chawla's contact details, and you can connect with her on her mobile, and she will help you through. We've invited her today on this particular day to give you some insight and to help our women in the community who are facing the issues, which is mental health related, can be in the family or they themselves. So thank you so much, Dr. Preeti Chawla. Thanks for giving your time. And I
Thank
always feel whenever
you.
I talk to you, I feel very, very, I feel that comfort. So I'm sure,
I'm
that's
glad.
your strength.
I'm so glad about it. Thank you for
Thank you so
having me.
much.
Always. It's a pleasure being with you.
Yeah. Thank you and all the best. And we'll see you again with some other new topic. And I'm sure you'll be able to help our women over there.
Sure, anytime, Jenny. It's a pleasure.
Thank you. Thanks.